The United Health Foundation recently released the America's Health Rankings 2023 Senior Report, which highlights strengths, challenges, and disparities in the health and well-being of older Americans across the 50 states. Now, Ohio ranked 37th this year, and Dr. Ravi Johar, Chief Medical Officer for UnitedHealthcare, is here to tell us more about the findings. And welcome, Dr. Johar. It is great to see you.
Thank you so much for having me today.
Tell me about America's Health Rankings 2023 Senior Report.
Sure. America's Health Rankings is a long-acting cooperation between the United Health Foundation, which is the not-for-profit arm of UnitedHealthcare, and America's Public Health Association. They've been putting out reports looking at all kinds of other national reports, bringing it together into one comprehensive report on the health of America's communities. And now they've broken it down into subcategories. This is the 11th year that they have looked at just the health of our seniors, folks more than 65. And it shows us trends on what's going on nationally as well as in each state, and gives us a lot of information to be able to delve into more.
What was the most notable finding in this year's report?
Well, there was a lot of neat things that came out of this report. Some very positive things like an increased number of geriatric providers, as well as increased access to high-speed internet for telehealth and things of that sort. But one thing that really struck me more than anything else was that for the second consecutive year, and then reversing a decade-long trend, we've seen an early death rate increase among America's seniors. And these are folks that are dying earlier than they should be based on health and other factors. So that's a dramatic change. And I think one of the things that really leads into that is the most dramatic thing in this report, and then that was that increase in drug deaths. Among seniors, we saw a 43% increase in drug deaths over the previous year. That's kind of shocking. And, it's surprising because most people think about drugs, they think of a younger population using it. But this report is showing us that it's across all ages and all spectrums, and that it's something that providers really need to be looking at, too, when they see their patients.
What can we do as a community to help out?
Well, I think one of the first things we need to do is just be aware of the issue and the problem. And reports like this help to let people be aware of that. But one of the things that's really beneficial is that there's a medication called Narcan or naloxone, which is readily available, often being provided for free. And having that on hand, if you do see someone experiencing a drug overdose, this can very quickly help save them. And that's an important thing to have on board. The other thing that communities can do is just put some emphasis and realization around the drug use and establish maybe some community centers and treatment centers, and then also encouraging people to use medical assisted therapies.
What are some of the other findings in the report?
Well, I think some of the things, like I said, some of the positive ones, there's an increased number of geriatric providers, and that there's an increase in high-speed internet usage. So I think those are some things that are really positive that came out of this report also.
And what are some of the highlights regarding the health of Ohio?
Well, in Ohio ranked 37th, which is not great, but certainly gives an area that there's some areas that Ohio is doing very, very well in. For example, one of the things, there was a 25% increase in geriatric providers, which is really positive. They also are very strong as far as a low prevalence of excessive drinking. So that's a great thing to see. And there's a very low poverty rate, and there's a very, very high usage of hospice when it's indicated. So these things I think are very positive. Now, on the downside, whenever there's really good things, there's also challenges. And in Ohio, the biggest challenges were a high early death rate. There's a really high level of obesity. And unfortunately, the very high prevalence of physical inactivity, which probably goes along with those two. But those were some of the main strengths and problems in Ohio right now.
And what can community leaders, policymakers, and healthcare providers do to improve our nation's health?
Well, I think that's the goal of this America's Health Rankings, is to just give you a snapshot of what's going on in your community and let the lawmakers, the public health officials, the leaders look at that and see what areas they want to concentrate on, and then look to see who is doing well in those areas, and maybe learn from a neighboring state or another area that may be doing well in an area that you want to, and also share where you're doing really well with other states so that they can improve their health. And the goal is to improve the whole health for everybody in mass.
Where can we learn more about this year's report?
There's a lot of great information, and if you go to americashealthrankings.org, you'll be able to get all of that information and delve really in depth into any areas that you want to.
Dr. Johar, thanks so much for taking the time to talk with us today.
Thanks. Thank you.